I'd like to talk about the Affordable Care Act and the healthcare system. My belief is that the historic mistake in passage of the Affordable Care Act was it sought to expand a system that already cost too much, a healthcare system. What is our goal here of those who want to repair the damage of Obamacare and replace parts of it? Is it to lower the cost of insurance for Americans? Is it to give them more choices of that lower cost insurance? And is it to put more decisions in the hands of states and into the hands of patients?
Yeah, thank you, Mr. Chairman. I think certainly the issues that you raise with choices and access and cost are at the heart and the center of where we ought to be putting our attention. As I mentioned in the 6 principles that I have for health care, affordability is incredibly important. It doesn't do you any good if you can't afford health coverage. Accessibility is absolutely imperative. If you have, today many folks have coverage, but they don't have care because they don't have access to the physicians that they'd like to see. So choices are absolutely vital.
Well, let me put it this way. I said that don't expect Senator McConnell to wheel in a wheelbarrow with a big, comprehensive Republican health care plan. That's because, in my opinion, we don't believe in that. We don't believe in replacing a failed Washington, D.C. health care plan with our own failed plan. We want to work on it step by step, large piece by piece. Is that how do you respond to that?
I think that's fair. I think that for individuals the American people need to appreciate that the last thing we want to do is go from a Democrat health care system to a Republican health care system. Our goal would be to go from what we see as a Democrat health care system to an American health care system that recognizes the needs of all.